Coming up on Nursing Success TV. This month, Dr. Phyllis advises a nurse whose manager may be breaking the law. And nurse Sherry Gomez shares her story on how she overcame obstacles to pursue her education and speaks to the advantages to working in a rural hospital.
Ask Dr. Phyllis is brought to you by New York Presbyterian Hospital. Amazing things are happening here.
RN Jackie in Pennsylvania has an important question on leadership integrity for Dr. Phyllis. Jackie writes, "My manager has achieved a level of incompetence that puts patients and her staff at risk. Her decisions are based on what will make her look good, even if it means fudging the facts or hiding bad news. I have evidence that patient files have been altered to ensure that nothing negative reflects on her. What should I do?"
Jackie, medical records are legal documents, and as such, they can never be altered or destroyed without following strict health information guidelines. What you're describing is a potentially criminal act. Turning a blind eye to practices that could potentially harm a patient or be criminal would be a violation of the Nursing Code of Ethics developed by the American Nurses Association. It requires honesty, courage, and integrity to report unethical colleagues, patient safety violations, or healthcare fraud. But you must be very aware of your motivations, very aware. Most organizations have a compliance officer and a mechanism for reporting potential violations confidentially. If indeed you have factual information, then you have a professional and an ethical responsibility to report this to your compliance officer.
Email your questions to AskDrPhyllis at nursingsuccess.tv.
One Nurse's Success is brought to you by Spanish Peaks Regional Health Center.
Sherry Gomez has been a nurse for 24 years. She is the Chief Nursing Officer, ER Director, and the Trauma Nurse Coordinator for Spanish Peaks Regional Health Center in Walsenburg, Colorado. Today, she shares her personal journey to pursue her education and discusses the advantages of nursing in a rural community hospital.
Well, right out of high school, I always dreamed of being a nurse, but things didn't work out. I didn't have a whole lot of support at home. My counselor at school actually forgot to submit my paperwork to go to college. And so it was pretty discouraging. So I wasn't quite sure what to do. So I searched around locally. I worked at the local supermarket. After having a child and pushing shopping carts, 8 months pregnant, I said, I'm not going to do this the rest of my life. And so at that point, I decided that I was going to go back to school. My husband wasn't really thrilled because I just really spontaneously quit my job and decided that I was going to be a nurse. And he's like, well, what are we going to do from now on till you become a nurse? You know, I got a job at another grocery store as a checker. I worked weekends, about my LPN. And then I started working, and I knew I wanted to be an RN, so I continued with my schooling. Because I had a child that was 3 years old, I decided to take the crash course, which is the associate's degree. Then in 1992, I graduated from Trinidad State Junior College, and then in 93, I got my RN degree. I had various experience, med-surg, home health, hospice, worked at the Veterans Nursing Home here. Then in 2003, I moved over to the hospital side and challenged myself. I was always afraid of the emergency room. And I bit the bullet, came over, and to my surprise, I just loved it. I just loved the emergency room. Around 2008, the director of the emergency room was quitting, and I was interested in the position. And we were in transition. We were getting a new CEO, which is our present CEO. And, you know, we have a really good relationship. But when I first met him and asked him to consider an ADN for the ER position, he asked me, well, do you even know what the trauma indicators are for a critical access hospital and a level 4 trauma facility? And I said, I do. And he says, well, I want you to prove it to me. And so I went back and I printed them off the database and I pasted them to his door. And the next day he said, "Oh, okay, you do know what you're talking about." So he changed the qualifications for that position and agreed to interview me and hired me. So at that point he said, "I really would like you to get your bachelor's." At that point, I'm a little older and, studying is a little bit more complicated than trying to work full time. But I said, I got to try this. I just got to do it. And I was amazed. And so for those of you that think that a bachelor's degree is just for managers, it's not. It really makes you such a better nurse. And when you have a bachelor's, it really teaches you to look at the person as a whole. Why are they here? What is happening at home? What is the culture that they were raised in? Because that impacts that illness. And if you don't address that, then they're going to keep coming back to you. Something that my mom instilled in me is that you gain respect by your employees by working beside them. And so when we get busy, I'll get out there, I'll help them with patients, I'll do whatever I need to do. And sometimes that may be cleaning the floor with body fluids or picking up trash, picking up laundry, whatever there is to do to get them through the day that seems to be hectic. I get out there and I help them. And in the rural hospitals, you learn to do everything. You learn to register patients, you learn to do your respiratory treatments, your EKGs, draw labs. But when you come out of it, you are so confident and your ability to work with such autonomy is amazing. Sometimes the larger facilities say, 3 strikes, you're out, and I'm out looking for a new employee. And I don't, as a leader, I've seen that. And that was one of the main reasons for me becoming a supervisor, because I wanted to change that. I wanted people to understand that, yes, we do appreciate you, and we need to try to accommodate you, because I want to retain those good employees. In rural facilities, it's very hard to recruit. And so, yes, we do probably do more accommodating than most bigger facilities. But when they walk away, I want them to understand that this was an amazing stepping stone for them, and that I really had a supervisor that supported me and understood and taught me what good nursing is truly about.
Thanks for joining us today. Click the banner below this video player to share your ideas and suggestions for Nursing Success TV. We'll see you next time.